I sure will. Okay, thank you everybody, and thanks again for your patience. My name is Shelly Krogh, and I am the Director of Field Liaisons with MAS. I'm actually stationed here I'm in Schenectady County, so I'm a local gal, and I cover pretty much the entire eastern half of New York State, all the way up from Clinton and Franklin counties down through to the southern Hudson Valley region. My role with MAS as a field liaison is to travel and meet with our various stakeholders, such as medical providers, transportation providers, government officials, to help them to understand what we do at MAS and our contract with the New York State Department of Health to manage Medicaid transportation throughout New York State. I've been with the company now almost 10 years. So I've got I've had an opportunity to meet with quite a few people throughout the state. And so I am looking forward today to providing you with some information on non-emergency medical transportation and some new updates that we have at MAS to hopefully help make your lives a little bit easier. So again, thanks for having me. I'll just ask, is it okay if I go ahead and get started with my part of the presentation, or is there something else that you needed to cover first?
Nope, go right ahead, Shelly. Thank you.
Great, thank you so much. Okay, so I'm sharing my screen, and what I thought I would first do is go through a little bit of background about what we do at MAS and the process overall in general. I always think it's helpful to understand this. A lot of times, what I find out in the field is that either there's new staff members that are helping enrollees to schedule transportation, or just in general educating enrollees on what's available to them and how the whole process works. So I'm going to first take you through a PowerPoint presentation on non-emergency Medicaid transportation, give you a little bit of background, and then what I thought I would do is I'm going to take you into our website and also into the online ordering system that we are rolling out. We've had a few different versions of this over the years, but we are right now on the cusp of rolling out our brand new version of electronic ordering with a lot of great new features to it. So I'll get started with the presentation. MAS is the company that contracts with the New York State Department of Health to manage Medicaid transportation throughout New York State. We currently authorize transportation for 60 counties out of the 62 throughout New York State, with the exception of Long Island, which is Suffolk and Nassau counties. So we started back in the early 2000s with the Hudson Valley region. There were originally 13 counties in that contract. And then since then, we have spread throughout the state, covering what we call FLNIES, the Finger Lakes and Northern New York region, the Western New York region, and then most recently in the last couple of years, New York City. So what we do is that we contract with the New York State Department of Health. It's a fee-for-service Medicaid program where we authorize for all mainstream and HARP managed care plans. And then also for waiver programs such as the TBI waiver and NHTD waiver programs. So what happens is that when there is an enrollee that needs to get to their medical appointments, they contact MAS and we help to authorize their transportation based on the plan that they have. Transportation services are provided by Medicaid enrolled service providers. We do not contract with individual taxi providers or ambulette providers. They're all enrolled through New York State and the New York State Medicaid program. We don't govern them or guide them as far as like the regulations. That's all done through New York State. They're also reimbursed through New York State Department of Health, not through MAS. So MAS doesn't provide the transportation and we don't reimburse for that transportation. That's all done through New York State. And then just to be clear that all Medicaid, non-emergency Medicaid transportation must be prior authorized. And that's the main point of this, is that the transportation has to be prior authorized, making sure that we follow all the guidance and policies and procedures of New York State and how they tell us that we would need to authorize that transportation. The next screen that I want to go to is the managed care provider list. And this is just a quick link to the eMedD website. And I'll definitely make sure that Luann has a copy of this PowerPoint so you have this as a reference. But when we talk about what plans that MAS authorizes for, we authorize for all of the mainstream and heart plans at this time. So oftentimes I'll get questions or I'll get a call from either a medical provider or a transportation provider, and they'll ask me, you know, why isn't this person eligible? So there are some plans that are carved out that MAS does not authorize for. And on the eMedD website, there is a tab for provider manuals and information for all providers. And you can scroll down and find the managed care information, and it will link you to a PDF version, which it lists all of the different plans for the managed care and which ones that MAS would authorize for, and then the names and numbers for those other plans that we would not authorize for. So on this next screen, I have a quick little snapshot of that list in eMedD. And as you can see at the bottom here, it lists the mainstream plan, and this would be one that MAS would authorize for. But if we get to Catholic MLTC, that would be authorized by this LTC PACE program, and it would provide you with a phone number. So I think that's just helpful for healthcare providers to have that because, again, oftentimes they'll go to scheduled transportation or they're not sure who they should be calling. This little resource is just a good one to have on hand. So if you do have a question about which plans you would call MAS for, you can just refer to this. And if you do call us and it's a plan that we don't authorize for, then we'll do our best to get you that information and reference this material for you to help you out with that. All right, my next screen talks a little bit about what MAS does and doesn't do as the prior authorizing agent for New York State Department of Health. Number one, we're not a broker, and we're not a transportation provider, and we're not a managed care plan. We do not set the rates or process claims for transportation providers, and we don't have transportation or medical provider affiliation. We truly are just an agent of the state Medicaid program, and we're compensated by a completely transparent administrative fee. So I think this is just helpful in understanding that we're kind of like the middleman, and I'm going to be explaining to you a lot of different resources that are available to you when something doesn't go right on a trip, or if you have questions or concerns that involve a transportation provider, where you can go to get those types of things resolved. And we'll definitely help you to do that, but I just think it's important to see what our role is and what we don't do. The next screen just explains a little bit about how the process works. And as you can see by the pie chart here, we'll start up in the top right-hand corner. And what happens is that when an enrollee needs Medicaid transportation to a medical appointment or something that's covered under a waiver program, they would contact MAS. So the member or an advocate of that member, a medical provider. When I say medical provider, what I'm referring to there is it could be a doctor's office, it could be a case or care manager, it could be a unit clerk at a nursing home. So any representative or advocate for the Medicaid enrollee could contact MAS. What happens then is that we pull up that enrollee's information in our system. So we have downloaded to us through New York State, through the eMedD and ePACES system, the enrollee's information, their most current up-to-date Medicaid information. So we have their address, their phone numbers, their Medicaid ID number, what plan they're covered under. We pull up that information in our system, and then what we would do is, step number 3 is that we would verify whether or not they're eligible. That's the very first step. We need to make sure that that enrollee is eligible. So when they're contacting MAS, that very first step, when it pulls the information from our system from New York State, we verify that they're Medicaid eligible. At this point, if that enrollee was not eligible, that's when we would give you that information from the eMedD website on who you would contact. Once we verify that that enrollee is eligible, in step number 4, the mode of transportation is determined based on the special needs. And what that means is that we are confirming whether or not the enrollee has their own vehicle, if they could transport themselves and get mileage reimbursement, because that is an option for them, and it is the lowest cost mode in almost every county in New York State. So if they had their own vehicle, we would schedule that transportation, and then they could get reimbursed for their mileage. If they are close to public transit, and I'll be defining this a little bit further, if they're close to public transit and they can take public transit, then they would be authorized public transit. And then from there, it goes to taxi level of service, wheelchair, stretcher, and ambulance. So we would establish that mode of transport for them. We would determine what the pickup and drop off locations are, the appointment type to make sure it's a covered service, and we would just gather those details of their appointment. Once we gather those details of the appointment and we do what we call finalize the trip, in step number 5, that trip is transmitted to the transportation provider via our MAS system, which is an online web-based program, which all transportation providers have access to. So if the trip was set up, let's say with XYZ Taxi, once that trip is finalized, XYZ Taxi is in our system. They are checking their roster. They would see that that ride is authorized to them, so they know when to pick up and drop off the enrollee. Once that trip in step number 6 here is completed by the transportation provider, what they do is that they come back into our system and they do what we call sign off or attest to that trip. And that just tells our system that they've completed the trip, or perhaps it was canceled, or the enrollee was a no-show. Whatever the status is, they're going to do what we call attest to the trip. And then once that trip is attested to, it generates what's called a prior approval number. And then that transportation provider takes that prior approval number and they submit their claim through the New York State billing system through e-cases. So this just kind of gives you an overview of how that whole process works. And I'll go a little bit further into some more detail on each one of these steps. All right. The next slide that I'm going to show you is a contact sheet. So there are sometimes when things don't go quite right on a trip, or you might have a more specific question that you need to talk with somebody beyond our frontline staff at MAS. And we always just like to say that in every organization, there's different levels of staff members, people who can help you a little bit further and have a little bit more working knowledge, who are a little bit more experienced. And we're set up in a very similar way at MAS. We have in the various regions, like I talked about at the beginning, we have staff members that cover those regions. And we work together in teams to get to know the area. We get to understand what geographic challenges there are in those areas. We get to know what services are available locally and where they might need to travel outside of the common medical marketing area. And we also just get to know the transportation providers and the medical providers that work within that community. So on our website, again, I'll make sure that you have a copy of this presentation, but on our website, there is a link to the county region locations. And then once you open up your region location, you can just see there's a Erie County sample opened up here. It would provide you with the toll-free number to request non-emergency Medicaid transportation. That's the main number that you would call for that county. It would list different transportation providers by levels of service. So oftentimes I'll get the question, I don't know who to use or who's available. And that link would provide you with that information of who provides different levels of transportation in that county. And then at the bottom of that list, which I'm going to show you on our public website in just a moment, is the key personnel at MAS that deals specifically with that county or that region. So you'll have what we call our ATM team, which is the Advanced Transportation Managers. There's a coordinator, and there's also 3 specialists that work along with that coordinator. You have the regional field liaison contact information, which I think most of you that are on the call today, I would be your regional field liaison. And then our other key staff member, their contact information is listed there as well, like our director of Medicaid, our director of utilization review, which she oversees all of the forms processing, 2015, 2020 forms. And then our vice president of quality assurance and compliance. So there's some other key personnel that you might need to reach out to at MAS that's listed on all of those resource pages for each county. And then there's also other links to local external websites such as the public transit systems within your county. If you ever had a question about their routes or how they work, there's some helpful resources listed on each one of those county specific pages. And again, I'm going to show you our website in just a moment, so I'll take you through that. There's often times when things can go wrong, or there's challenges, or there's feedback that you might have on a trip, and we just want you to know that there are ways that you can report that to us. So our role as an agent of the state is to report any type of feedback, compliments, complaints, fraudulent activity, which I know for some of you in this area that has been a challenge, especially up in our northern New York region. So there's a way that you can report that to MAS, and what happens is that when that's reported to us, we then take that information, and if it's a complaint or a concern, we gather whatever details we can from the parties involved, and then on a weekly basis, that information is uploaded to the New York State Department of Health. We have bi-weekly meetings with them where we discuss those concerns and that feedback and see if there's a problematic transportation provider. Perhaps we would have to have them on an action plan. So we work with the state to either escalate that, or to put them on an action plan, or to even perhaps escalate it to the Office of the Medicaid Inspector General or the Attorney General's office if they needed to be investigated for fraudulent activity. So there is a means for you to report that to us. These two pictures right here show you the links that are on our website. And again, once I get to that part of the presentation, I'll just show you where those links are and how you would report that information to MAS. It could be anything from inappropriate driver conduct or safety concerns, or the transportation provider showing up late or not showing up at all, anything along that line that you can report to MAS. And then we will definitely be sending that information on to New York State. Okay, so these last couple of slides, it just dives a little bit into some of the information that we would need in order to schedule transportation. I am going to be showing you the online ordering version as well, so I'll talk a little bit more about this as I get into the actual manipulation of the system. But information that you would want to have available when you're contacting MAS, you would obviously need the enrollee's information, their Medicaid number, their name, their date of birth, their current address, and contact information, just so we can make sure that our records are up to date, so that we're relaying the most current information to the transportation provider. We also would need the medical reason for the appointment. For example, if it was a discharge, or if it was an appointment to see a specialist or a dentist, we would need to know that medical reason. We would need to know the level of transportation required based on their medical conditions. 2015 might be applicable or needed for higher modes of transportation. We'll talk a little bit more about those forms again. We would also need to know the name of the ordering or discharging physician, the date and time of their appointment, the location of the specific street addresses, including the room or department or location. I know a lot of you operate out of rather large facilities or large buildings. It's always helpful to have what entrance the transportation provider might need to go to, or the suite number. That information is very helpful. And then if applicable, their preferred transportation provider. There are certain levels of service, taxi, wheelchair, stretcher, ambulance, where we follow New York State policy, which says the enrollee has the choice of who they want to ride with. So if they're at those modes of transport, they can tell us who they want to ride with. If you are calling on their behalf and you have a preference, then you can let us know which company you would prefer to use. And then if neither of you have a preference, it goes into rotation, which is like all transportation providers are in a line, and the next one up gets the trip, and then they rotate to the back of the line. And then finally, any other special instructions that are needed for the trip. Perhaps they have a good relationship with a certain driver. They could put a request in to be able to ride with that driver. So any other special instructions, if they have somebody that's riding along with them, like a medically necessary advocate for them, then we could put those special instructions on the invoice so the transportation provider would see that. Let's go a little bit into the modes of transportation so that you're aware of what's available. And this does vary county by county. There are some counties that do have a little bit more extensive public transit services, and then there's others that don't. So it is specific by county, but in most areas, mileage reimbursement is the lowest cost mode if they're driving themselves or if they have a volunteer driver, like someone from their church or their community that drives them to their appointments, they can get mileage reimbursement. There is public transportation in quite a few of the areas. Even in our more rural areas, they do have public transportation that's available. There's also a curb-to-curb service, which might be a taxi or livery provider. And also in some of the counties that I'm working with, there are volunteer driver programs. So if you're familiar with Franklin and Clinton County, they have JCEO, which is an extensive volunteer driver program where the JCEO has volunteer drivers that work for their organization and trips are authorized to them at a lower cost mode. There's also door-through-door or ambulette services, which includes ambulatory service, which would be somebody who maybe walks with a walker but needs help getting out of the vehicle and getting in through the door to their appointment. There's also wheelchair level of service, stretcher level of service. And then from there, it goes up to the higher modes, which is the ambulance, which is basic life support, advanced life support. And then finally, commercial travel. There's some areas where if they're being discharged, for example, here in Schenectady County, if they're being discharged from Conifer Park and we can get them to the Greyhound bus station where we could get them back to Buffalo via a Greyhound bus, and that's a lower cost mode. We work with commercial travel departments. We do have a commercial travel department within the MAS that works with the various commercial travel agencies to help arrange those transportation arrangements. And then if they get to their final destination and then they need another taxi to get them home, we work to secure all of those different levels of transportation. Some modes of transportation do require what we call a 2015 form, and this is a New York State form, which is required for taxi level of transports and above, or if they live within 3/4 of a mile of a bus stop and they're not medically able to take the bus, then we would need that 2015 form with supporting documentation from the physician. So the form 2015 is what we call verification of transportation abilities form. It is required for all ambulatory, wheelchair, stretcher, and ambulance modes of service. It is required for taxi if the enrollee lives and resides less than 3/4 of a mile from a bus stop. It must include a medical diagnosis and how mobility is impacted. And this is key. There is a section right on that form that you have to explain what the medical diagnosis is, box number 6. And you definitely want to make sure that you're telling our utilization review team and telling us how their mobility is impacted by their diagnosis and be as specific as possible so that we can make that determination for that 2015 form. It does not replace the requirement for obtaining prior authorization, and it's never needed for mileage reimbursement or public transportation or any mode when requesting a hospital discharge. So that's a little bit about the form requirements. I'm going to also show you where there's a resource on our website. This last slide that I have on this section about who can sign a 2015 form, there is the list of the licensed medical professionals on your screen right now. These are folks that can sign off on those 2015 forms. It's a little bit of a change from a couple of years ago where it had to be the physician that signed off on the 2015. They've expanded that list of medical professionals. And so these are the folks that can now sign off on those forms, which helps to expedite the processing of them. And I'm going to show you some updates on our website where you can see if the form has been received and whether or not it's been processed. Are there any questions so far or anything that I can answer? At this point, I am going to transition over to our website and the online presentation part of it. Are there any general questions so far that I could answer?
This is Sandy at Dr. Ryder's. You actually may have already addressed this, but are Fidelis members, can they get this service as well?
So it definitely depends upon which managed care program they have within Fidelis. So when you get this link, if you can see my screen right now, I'll go to it. When you get the link for eMedMe and you go to this information for all providers, there is the managed care plan information right here. Once you open this up and you go down to the list of all of the different managed care plans, you'll see which plans are covered by MAS and then which ones you would have to contact that local organization. So I don't know off the top of my head which ones are, I couldn't answer which Fidelis ones are covered and which ones aren't covered by MAS, but if you look here, you'll see anything that says HARP or mainstream is covered by MAS, but if you look here with these other plans like this FIDA, this would be a plan that you'd have to contact this number. So if you call MAS and it's a plan that we don't cover, we'll do our best to give you this information, but you can also just refer to this resource page and look up the different plans. Like Fidelis Care at Home, actually this is the one that I had yesterday, it's code GD. The enrollee wasn't covered through MAS. The provider had to contact this 800 number right here for transportation.
Great, thank you very much.
You're welcome. Are there any other questions on some of the information I just covered? And I definitely will be getting into more detail through our website. I just wanted to show you the more specific links here through the public portion of the website. Okay, then I'll get started on this section and just show you a couple of those resources that I talked about that are built out for you. This is the public portion of the website, so this is everyone can access this. As medical providers, I'm going to show you how you can get into the internal system where you will do the online ordering. But if you need to come to this section or you need to refer an enrollee to this section for education, all of these links at the top in blue open up each one of these sections. So as the transportation, as the medical practitioner, if you come right to this section and we go to forms and resources, when I talked about the 2015 form or even the 2020 form, all of those resources can be found right here with the policy and procedures and details on what is needed on the form. All of that can be found right through these links. Like I talked about that box number 6 and where you would write the diagnosis and how it impacts their transportation abilities. This is where you would fill that information in. Another thing that we commonly see left out is the NPI number. So just, again, like the form and then all of the details on how to fill out the form can be found right through our website. And so these are some great resources for you. If you're helping an enrollee with the mileage reimbursement forms, all of those can be found in this list under other forms. So again, a great resource for you. There's some great resources for the enrollees as well. So if you're trying to educate them, you can come right here to this section and you can pull up specific forms or frequently asked questions for enrollees to help them schedule transportation. When we come over here to this location section, this is where I talked about how you would contact MAS and the different groups. If you select New York State, and if I go to the Hudson Valley region, I will see from this Hudson Valley region all of the different counties. And if I go ahead and let's say I click Schenectady County, it will open up that page of resources for Schenectady County. The 800 number, the different transportation providers, the public transit website. It also will share with you the MAS Schenectady staff members, that advanced transportation management team. Precious is the coordinator, and then she has 3 specialists that work with her. You have all of our email addresses and our phone numbers. So those do vary by county. So just you open up whatever county you need and you can find all of our contact information there. So again, just a great resource for you. When I explained to you the reporting of fraud and feedback, those 2 pictures that were in my slide, they're right here. So if you had to report a trip concern or had to report fraud, you can just select either one of these icons, and it just explains the standards at the top. But you scroll down to the bottom and you just click on these little orange boxes. And this is where you'll see there's little red asterisk here. You just would pick whatever the type of concern is. So perhaps it's a concern with a transportation provider. Perhaps they were, it's a complaint about the transportation provider that they were late picking up the enrollee. You could then give us the specific information here, tell us the enrollee's name and invoice number if you had it, what happened. And then at the bottom, if you want to, you can enter in your information. You don't have to, you can remain anonymous too, but if you would like us to follow up with you, you can put your information in here and submit that. And that goes directly right into our compliance department so that they can then review the information and follow up on it. So it's just a great, easy way to report that. If there's something that's fraudulent, perhaps you hear that the transportation provider is paying the enrollee to ride with them. I do often hear that. You can come right here to this section and give us as much detailed information as you have as possible. And again, if you want to fill in your email and information, you can at the bottom submit that. But it's very important just to report fraud or feedback, because that's the only way that something can ever come about or happen is if we know about it. So it's just a really easy way for you to report it. And it is important to get that information into us so that we can do our due diligence and follow up and then escalate that to the state as needed. Are there any questions about the public portion of the website or resources that are available?
Yeah, we have one question that came in, and it's for patients that are needing a same-day appointment. Are practices able to request same-day transportation online, or is that type of request via phone only?
So either way, that's a great question. So as the medical, enrollees are advised that they need to call at least 3 days in advance of their appointments. If it is less than 3 days, let's say, for example, it's a sick visit. If their child's sick and they need to get to urgent care, they can call and they can schedule that trip. But for regular types of routine appointments, they do need to call at least 3 days in advance. If it is less than 3 days, the medical provider would need to contact MAS, and they can do it two different ways. They can either use our automated phone system. They can contact MAS, they can speak with a representative, they can listen for the IVR prompts, and they can schedule transportation just stating that they're the medical provider, or they can go online and they can schedule the transportation online. And that's the next step. I'm going to show you how you'll access our online trip requests and show you that new version of it, and you can schedule the transportation right online, which is very simple and easy to do. Are there any other further questions before I get into the online trip management? Okay, all right, great. So what I'll do here, the first thing that I want to show you is how you'll gain access to the MAS system if you don't already have access. So the medical providers are able to have their own access to the system. So if you don't currently have a login, so when I select this button, you'll see it takes you to the login page. If you don't currently have a login, I would ask that you email me the information. I will need your first and last name, your email address, your phone number, the name of your organization, and your department. And I will also send that back to Luann so she can get that out to everybody, but I would need that information. First and last name, email address, phone number, your facility name, and then your department or your title. And then what we do is that we create a username for you and establish your user group so that anybody that works in your organization, you can then create and delete logins for them. So let's say, for example, it's Glens Falls Hospital. We would create the user group for Glens Falls Hospital. We would then create a username for the system administrator or super user there. So whoever contacts us, we would create their super user account, and then that person could then create and delete accounts for your user group so that you can keep control over that of who has access to the MAS system for your organization. So if they were to ever leave or you have a new staff member come on, you are allowed to create and delete those accounts. So access, if you don't currently have it, you can send me that information via email, and I'll work with our operations department to get your username and password set up. Once you have your username and password, you come into this part of our system, and I'm going to go ahead and I'm going to enter in my test account information. So you'll enter in a specific username for you, and then you're going to enter in your password. And that is something you'll get a temporary password, and then you will be resetting it to one that you can remember. You'll check this little box for our terms of use, and you'll select login. Once you do that, it's going to take you to the what we call now the dashboard, which is a much simpler way of looking at the information that you need. If you are the person that's creating accounts for your staff members, you could come right up here to where it says manage, and you could add users or edit users that work for your organization. And I could help you out with that more specifically if you needed help once you get set up with access, I could talk you through that. So that's how you would do that. There's also some message alerts, and there's also even a little feature here where if you come across like an issue or you have a request, you can enter in a feature request. Perhaps the system doesn't do something that you want it to do. You could enter in a request to have it do that. Or if you come across a bug, you could go ahead and enter whatever that glitch was and report that right to our IT department. But otherwise, you'll come to this section and you're going to either select an enrollee to schedule transportation for, or if you're a company that has standing orders, if you're a dialysis clinic, you could manage your standing orders from here. But we're just going to focus right now on these specific enrollee appointments. So I would go to select enrollee, and it's going to ask me for 2 identifying pieces of information. First of all, their date of birth and their Medicaid number. So I'm going to go ahead and I'm going to enter in a test account that I have. Once I enter in the birth date in the proper format, you can see the box turns green with a little check mark. And then I'm going to go ahead and I'm going to enter in their Medicaid number, which is always 2 letters followed by 5 numbers and then 1 letter. And you can see once I enter that in the correct format, the box turns green with a check mark. Then I'll go ahead and I'll select search, and it's going to search our system for that enrollee's information, and it will pull that information up right here so I can see it on my screen. It will tell me their name, their Medicaid number, their date of birth, and then the current address and phone number that we have on file. Now, if this address is permanently changed and it needs to be updated, you would want to call MAS and we would update that information in our permanent record. But if it's just something where they're being picked up from a different location, I'll show you how you can actually adjust that within the trip as you're scheduling it. So if it's a permanent change, contact MAS and we'll update that information. But if it's just something that's temporary, I'll show you how you can update that right from the trip itself. So from here, there are 3 options that you have. You can either create or manage their standing orders, you can schedule individual trips, or you can view what forms are on file for that individual. Let's first just go to forms because that's really the easiest. So those 2015 or 2020 forms, if they're received and processed, you will see the information under this section. So you can see that the 2015 form was uploaded, that the transportation type that they're approved for, how long they're approved for that transportation request, that different mode of transport, and that the status is complete, or perhaps it might see that it's incomplete or that it was denied. So it just helps you to keep track of those forms and when they're expiring and when you would need to submit a new form. So this is a nice little new feature for you to keep track of that information. And just to kind of let you know that we are so very close to the forms being able to be submitted electronically. They are working on the last piece with New York State, and we're hoping within the next like 2 or 3 weeks that will be able to submit the 2015 forms and 2020 forms electronically to MAS. And that will just save everybody a lot of frustration and time. So we're very, very close to that being available. We're just waiting on a couple of pieces to be able to authenticate the forms. So again, we're very close and we're very excited about that upcoming change. So again, not only will you be able to upload the forms here, but you'll also be able to see what the status is of those forms. To manage individual trips, so like let's say, for example, they're going to a doctor's appointment, or like you just had asked the question about needing to schedule a same-day appointment, you would come to individual trips. And the first section right here, it's going to show you any upcoming trips. And there's little icons here that tell you whether or not it's a single trip or whether or not it's part of a standing order, if it's a round trip, if it's a one-way trip, and it lists all of their upcoming trips. So this person happens to have trips that are part of a standing order, but they also have an individual trip right here. So you can see all of those upcoming trips. You can make changes to them. You can view them. You can cancel them right from this screen. So it shows you the next 14 trips that are in our system, and then it will just keep expanding out those 14 trips that are in our system based on what's been authorized. At the bottom here, you'll see frequent traveled destinations. So what we do find is that enrollees typically go to the same appointments or the same locations. So you will see their frequently traveled destinations here at the bottom. So if they're going back to a location they've previously been to, rather than having to recreate the whole trip, you can just come right over here to the repeat function. And it will ask you, are you sure that you want to repeat the trip? Which you would say yes. You would select the date that you're going to repeat the trip on, submit it, and then it will take you through the various steps just to confirm that that is the same trip and just a different date of service. So I'm just going to confirm that they're still going for physical therapy. The trip is now on the 27th. I'm going to confirm that this information, my contact information, is correct. I'm going to confirm that the addresses were still correct. I know I'm going through this fast right now, but I'll show you a little bit more in detail when I show you how to set up a trip. But I'm just confirming that everything is still the same, that they're still getting mileage reimbursement, and I check these boxes. Once I get through, I submit it, and the trip is created. It's that easy to just go ahead and to repeat the trip. I'm in a test account here, so I don't want to bog it down and have it be slow. So, but you just go right through those steps, and you can easily repeat a trip to a frequently traveled destination. If you had to create a new trip, you can come right here if it's not a trip location they've been to before. So let's say it is that example where it's a same-day appointment and you need to get them to their doctor's office, or you need to get them to an urgent care facility. You could come right here to create a new trip, and it's just going to ask you, making sure that you definitely want to create a brand new trip. It's not a frequent travel location they've been to where you could repeat it. But I say, yes, I want to create a new trip. And from here, I would want to select the medical reason. So let's say it is a, I'm going to say it's a medical appointment to their primary care. So you can see these are all of the different reasons. I would select that it's a primary care appointment. Then I have to select the medical reason. So let's say it's a primary care office visit. I would go ahead and select that. Select the date of the trip. I'm going to go ahead and say that they need to be there today. And then I'm just going to confirm that it's their medical provider on the trip. If you had to change that medical provider, you could go right here. It's going to pull what we have in our system on their profile, usually their primary care physician. But if you had to change the provider, you could go ahead and select change provider and enter in the NPI number or the first few characters of the provider's name, and it will pull from our system their provider information. I come here, this is my contact information. I'm just going to say, confirm that it's correct. It will automatically load with your information there. And then I get to the address section. As you can see, when I check these little boxes, it allows me to go to the next section. If I forget information, it won't allow me to go any further. I have to make sure I fill out the appropriate information section. This address section defaults to their home address. This is where if they were being picked up from a different address, you could just select the edit button here and change that. So that's the kind of that workaround where if they're not being picked up from home, you could enter in the address that they're being picked up from. But let's say they're being picked up from home and they're going to 624 McClellan Street. So I can just start to type in the first few letters of the destination address. You can see it pulls from our system the matches. I just select the address. They're going to be dropped off at the main entrance. Then I have to pick the appointment time, and you can see this defaults first. So let's say their appointment time, and it does have to be on a same-day trip, at least a 2-hour window, because we do have to give the transportation provider time to view it in the system. But let's say they have to be there at 12 o'clock p.m. It's going to go ahead and schedule 12 o'clock p.m. with an hour ahead pickup time. You can change this if you want to, but it does default to 1 hour ahead. We just like to make sure that we give the transportation providers that window so that the enrollee is not late getting to their appointment. If they need a return trip, I just go ahead and select return trip, and you can see that it automatically just reverses the addresses. It will put in a suggested pickup time based on the appointment reason. So if this is for primary care, you can see that it gives like an hour-and-a-half turnaround time. If you wanted to change that, you can absolutely make a change to that time. You can also still put in a will call time, where that means that once the appointment's done, the medical provider or the enrollee can call the transportation provider directly to let them know that they're finished with their appointment. But we leave that up to you. It will automatically default based on the medical reason, but you can make changes to that if you need to. If there was a third trip leg, you can even add another trip leg in there. So like, for example, if they were going to the doctor's office and then to get lab work done and then back home again, you could put that additional trip leg by just clicking right here where it says add a leg. Once this information is entered, I say that it is correct, and then it takes me to the next section where it will show me the transportation types that this person is approved for. If they need a 2015 form, it will put in parentheses that form 2015 is needed. If they're being discharged from a hospital, there is no form required. So you will be able to select any one of these modes of transport. But let's say, for example, this person is traveling home by taxi or livery. I can go ahead and select that. And then what it does is it pulls from our system the eligible transportation providers based on the information that they've loaded in our system, their availability, their zip codes that they operate from. So I can see from this list all the transportation providers that are available. And you can see which ones are available. In parentheses here, it shows, you know, if they accept the zip code. If they don't, they would be kind of like blackened out if they don't accept same-day trips. And then I'm just going to scroll down. I'm going to pick our training vendor because I don't want to send this accidentally to a provider. I'm just going to select training vendor, and it goes ahead, it loads their information. It tells you their phone number right here. If you wanted to call them and confirm, you have that, or you give it to the enrollee. There's just some special instructions here. If you needed to check anything, you could. But otherwise, as long as everything is all set, you check this little box, and you'll see there's a submit button right here. And it will go ahead, submit that information, and you'll get a confirmation page with an invoice number. You can print it. At the top, it gives you just the basic details, pickup, drop-off times. It gives you the phone number, and then it just gives you the further details, kind of like detailed out here. So if you wanted to print it, you could go ahead and print this. So that's how easy it would be to schedule that same day appointment. You know, I talked through that, but I think it takes like in total probably less than a minute for you to go on here and schedule that same day appointment if you needed to. Are there any questions about how I did that at all? I think, and I'll just offer this out to you too, because again, I think everyone on the call here is within my region. So once you're set up with access, I know it's oftentimes, you know, I go through this rather quickly and I show you it and you're like, oh, that looks easy. And when you get ready to sit down and you have access to the system, if you want me to, I can log in with you at the same time share my screen. We could do this together the first time through. If you wanted me to come and sit with you and your staff, if you want me to do a little training session, I can also do that either in person or via the web, whatever's easiest for you. I'm more than happy to work with you and to show you like in person how to do this. So don't feel like you're stuck. But we really did try to make this version as easy as possible for anybody using the system. We always like try to say that, you know, if you're ordering something on Amazon, you don't need instructions on how to do it. And that's really how we tried to build out this online ordering system, where it's really so easy that you don't need instructions. You know, and if you do need help with it, I'm more than happy to sit down with you and to show you how to do this and work with you on it. Just
Shelly, I don't mean to interrupt, but we are getting to the end of our time, and a lot of people have to drop off. We do have a few questions, though.
Sure.
The first one is to set up an account for the northern region. Should we email you to do that, or is there someone else they need to email?
Yes, definitely email me. Here, let me just put up a quick little screen here. I'll put up my email address. It is SKROGH@medanswering.com. And you're going to send me your first and last name, your email address, phone number, and your organization name, and your department or title. And those are the pieces of information that I would need. And Luann, I can send that to you too. So if you want to send out like a quick little email.
Yes, that would be great. Absolutely.
I'll make sure that you have that. Yep.
The next question we have, if a patient is in a different region than the provider, does it work the same way?
Yes, it does. So I think they're meaning by provider being the transportation provider. I think that's what they mean on that. It does work the same exact way. There are some cases where the transportation provider might not have that zip code selected in their profile. So if that's the case, we can work with them to make sure that they, like if the enrollee really wants to ride with a certain provider, we could contact that provider and make sure that they have their zip code selected. So sometimes like it's not that the provider is not available, it's just that they need to make sure they update their profile so that they show available for that enrollee's trip.
Okay. And I think too, the provider might mean that a different care provider. So if a patient, because sometimes people will be sent out of their area to a care provider, to a practice.
Okay, yep.
So I might live in one area, but I'm going to another area, and it is quite common in the North Country that there's, you know, live in Malone, but they got to go to Plattsburgh, or,
yes.
you know,
Yep.
they're
Okay.
in Essex.
I think I understand now. So that has to do with their common medical marketing area, which is the 2020 form. We have recently updated our system to like really incorporate what specialty services are available locally, and then when they would have to go outside their common medical marketing area. And we adjusted like the mileage on a lot of those medical reasons. So there may be some that in the past it triggered that they needed a 2020. And now they won't need that form any longer. But if it does come up where they need a 2020 form, so let's say they're traveling out of Malone and going to Burlington, but it's for, let's say, dental. And in that, we would say that, okay, well, dental is probably available closer to them, but let's say it's a specialty dentist that they have to go to. Then the 2020 form would be required. And that 2020 form is the physician that is referring them is telling the state why they need to travel out of their common medical marketing area for that specialty service, why it's not available locally. And they submit that form into our utilization review team, and we review that and then make note on their account to approve them to go outside of their common medical marketing area for that specific service. So it does happen. I would say it might happen a little less now because we have expanded those reasons and the mileage in those areas so that it doesn't trigger as often. But there are definitely some cases where a 2020 form would be required.
Anyone else on the line have any questions? Okay, great. I know we're a little bit over and everyone has to get to work, so I thank you all for attending. Shelly, thank you again for all your time. We will provide everybody, we do record this, so you'll have the recording. You'll get the slides that Shelly has, and as well this information here to create a group. If there are any other questions, you can certainly, again, you have Shelly's email, so email her directly if you have specific questions that you think are more pertinent to just your practice. Thank you, everyone, and we will see you in October.